Thank you very much. Thank you. Yes, let's talk about a little bit about AI assistants. How can AI assistant help in the healthcare sector to create a better medical care in this case? For the moment, for the people here who don't know the MSG is somehow like a hidden champion in the IT sector, which helps companies to get a better IT infrastructure to develop the different use cases we have in terms of the changes of the time. And so we are over 40 years in the sector and owner-based, and so we can settle the different things. And as an owner-based IT consulting group, we can help our customers to get more and more experience to the newer upcoming challenges we have in the structure. So in this case, we started in 1980, over 40 years. Just have to double click here. We are now a company of over 10,000 people and experts to help our customers. Starting from a small group with 3 founders to get into the charge of a $1 billion company, and this owner based in Germany is unique in the IT sector, and so this is very important what we want to point out. And we started in 2016, I think, to work with AI assistants and digital assistants. It doesn't click. Thank you. And to focus the different branches we do have. So we are somehow like a matrix organization in Germany. So we do have a public sector, we do have a healthcare sector, we do have automotive and so on. And especially in the healthcare sector, we can see that we do have the different challenges in kind of digitalization. We do have the staff shortage in cases. We do also have the terms that we integrate people in Germany which are not familiar with the German language. So we do have the cultural change, also the language circumstances, and also the cost pressure, what we see between the efficiency and the quality, what we want to achieve as a company in these cases. And also what we have in this case, the regulatory requirements in Germany and also in the European concept, like if I talk about C5, for example, as a certificate which is necessary since the 1st of July of 2025. So we do have many things about data protection and the different changes in rights. Also, we do have the things about the customer focus and the communication in this use cases which are created for our patients, for our customers. And what we also can see is that we also have this complex in enquiries which are changing step by step over the time. If we see, for example, that, for example, my son is 12 years old. He always uses the technology in another way we use. And I have the chance in the last 4 or 6 or 8 weeks to visit different doctors and larger companies to sit in and hear what they are talking about with their customers. What is happening if a patient is calling them? And one especially part was an elderly woman, 85 years old, talked to a hotline in Germany for a doctor. She sat there for 45 minutes one time. She sat there a second time. And the first thing she talked about was, why did I have to take this long time in this queue to get an answer for a simple question I have? So we do have this kind of separation between a private patient and a general patient in Germany, and these are things where we can optimize with AI and with intelligent queue in certain of the telephone and the communication, which helps, for example, the companies, and also which helps the customer and the patient in the first time. And we are doing this and helping our patients with our own platform. This is the NeoHelden platform. It's a multi-channel platform where we can create different use cases for all of these kind of circumstances, and it is hosted in an omni-channel way. So we are not focused on one hyperscaler. Even the discussions of the political circumstances with the US government and so on. So we can host all of the things in a German computer center, for example, which is certified by the BSE, for example, and set up all these kind of patient-relevant things to support the different use cases the companies and also the users have. And we have this in place, for example, with over 50 customers currently, which are using this service live in production, and taking over thousands of minutes every day to optimize their call center and their chat informations. What do we see for these kind of AI assistants? We are not this kind of platform which just focuses on we do only AI adjacent or agents. We combine the traditional technologies like natural language processing, also the newer technologies like large language models, and so we can focus on the different use cases, on the best effort for the customer, and also for the use case to get the highest priority and the highest effort out of the use case in automation. And what we do have in production currently with our customers is this kind of appointment scheduling, like making an appointment with doctors, with different kind of companies. Also to get out of FAQs, I like to have an information. The easiest way always is, yes, we talk about chat. The little bit more experienced way is to do it on the phone, because we have some latency in the phone, and also we want to provide some billing information, some contact information, some account information. So we are going more and more deeper in the infrastructure of the customer to talk on a secured way with the back-end systems of the customer. And what's also important is that we can, or we could do an patient registration for different patients to have it in a completely digitally way. Other areas of possible applications are reminders. We also can do in somehow outbound calls. For example, if I make an appointment for an radiologist in Germany, I do have to fill out some forms after making an appointment to have a complete reservation. If I'm the bad patient which keeps this out and doesn't fill out all of the informations, I can do an outbound call to remind this kind of person to fill out this kind of information. Also, this kind of feedback collection. We do have cases with self-diagnostication and also this kind of prescription management. These are different use cases which we have in live, in production with our customers. And I have a short German example. The idea is I want to make an appointment, so I call this reception of the doctor, and I want to have an appointment, and I have to provide different informations. This will show us how we can classify these kind of informations. We will see in this dashboard when the call comes in. Also, if it's finished, we have different ways to do this within a natural language or a speech. Also, we could upload, for example, a screenshot or a picture of in German, it's in the medical way, die Überweisung. And we can make an OCR on this kind of document to detect what is the current need of the patient. So I will just
Herzlich willkommen bei Ihrer Radiologie der Zukunft. Wie kann ich Ihnen helfen?
Ich habe hier so einen Überweisungsschein bekommen und soll einen Termin vereinbaren.
Gerne unterstütze ich Sie dabei. Um welches Verfahren handelt es sich? Also benötigen Sie einen Termin für ein MRT, CT oder Röntgen?
Da steht irgendwas von CT auf dem Schein.
Danke für die Information. An welchem unserer Standorte möchten Sie den Termin wahrnehmen? Wir bieten Termine in Karlsruhe, Frankfurt am Main, Ismaning, Hamburg oder Berlin an.
Ja, ich wohne ja in Ismaning, also somit ja, macht nur Ismaning eigentlich Sinn. Ja, wäre super.
In Ordnung, dann notiere ich Ismaning als Standort. Damit ich Ihren Termin weiter vorbereiten kann, darf ich bitte Ihren Vor- und Nachnamen wissen?
Ja, natürlich. Mein Vorname ist Christian, mein Nachname ist Hertlein.
Danke, Herr Hertlein. Könnten Sie mir bitte Ihr Geburtsdatum nennen?
Ich bin am 5.4.1981 geboren.
Vielen Dank. Sind Sie gesetzlich oder privat versichert und wie lautet der Name Ihrer Krankenkasse?
Ich bin gesetzlich versichert und bin ja bei der Krankenkasse AOK.
Haben Sie einen Überweisungsschein?
Ja, das habe ich.
Möchten Sie den Überweisungsschein hochladen oder mir alternativ die Verdachtsdiagnose diktieren?
Ich kann es gerne vorlesen, was drauf steht. Da steht was von chronischer Husten, Verdacht auf Lungenrundherd.
Kommen wir nun zu Ihrem Termin. Gibt es bestimmte Tage oder Uhrzeiten, an denen Sie Ihren Termin wünschen?
Grundsätzlich Mittwoch und Freitag, bestenfalls am Nachmittag.
Mittwochs hätten wir den 1. Oktober um 10:15 Uhr oder freitags den 26. September um 13:45 Uhr einen Termin frei. Wäre eine dieser beiden Möglichkeiten für Sie passend?
Wegen dem Nachmittag würde ich jetzt den zweiten Termin gerne nehmen.
Vielen Dank. Bitte denken Sie daran, Ihre Blutwerte, Kreatinin und Ihre Schilddrüsenwerte mitzubringen. Diese dürfen nicht älter als 3 Monate sein. Ich habe Ihnen den Link zum Anamnesebogen per SMS geschickt. Bitte füllen Sie diesen zeitnah aus. Sobald wir alle Angaben geprüft haben, schicken wir Ihnen die Terminbestätigung per SMS. Haben Sie noch Fragen zu Ihrem Termin? Sie können sonst gerne auflegen.
Nein, super, Dankeschön.
So, and as you see, I'm getting a short message to generate or to fill out a formula, and we can combine the different techniques to help in case of the customer experience to make a completely process to generate something. I mean, in this case, to generate something, it's just not an appointment. It can be used in different ways, and that's the point how we are helping different health companies to optimize their processes in the way they need, and to fill out and process the different use cases they have. So in this case, we have seen in the first step, yes, we had some latency. It was a little bit slower, and then the model just got a little bit faster. I have heard in the past time of different appointments. Yes, currently we have the best AI we can have, because it's getting better and better every day. And each month we are getting new models we can use, and that's what we are doing with our platform as MSG, for example. We are orchestrating a use case which we have and are combining in case of our data security in Germany, which is important for us, that we can solve all the different use cases and are between and in usage of our regulatory for the different things in case of data security. So this is very important, because we can also provide our platform in case of an hyperscaler. We can provide this for a computer center in Germany. We can provide this in a computer center which is hosted by your own. And so we are trying to solve the different things which you have as a customer. And so this, for example, shows a small use case like an appointment making, but it can be combined in many ways, like the ideas and the creativity we have for use cases and problems we have in the future.